Hello everyone. In this video, we are going to talk about the kidney. So the kidney is the last Zang organs we are going to introduce. The location. The kidney is in the lumbus, consisting of the two parts, one on the left and the right sides of the spine. The meridian. The kidney connects with the urinary bladder, the orifice of the kidney, ears, urethras, meatus, external genitalia, and anus. So from here, you need to remember the orifice, the meridians, or which is the paired organs or coupled organs. So if in a test, we ask that which of the following organs is the coupled organs of the kidney? Now you need to choose the urinary bladder. So the function of the kidney. The kidney has three functions. The first, the kidney stores essence, dominates development and reproduction. The second, the kidney governs the water metabolism. Last is the kidney receives qi. So we're going to explain one by one. The first, the kidney stores essence. Storing essence is one of the most important function of the kidney. And as we said previously, the essence, the five Zang organs, they all store essence without discharging it. And then for this essence, where does the essence come from? There are two sources of essence. One is innate essence, and the other one is acquired essence. So the relationship between innate and acquired we have introduced in the theories, in the philosophy. And innate is something from your parents, and the innate essence is stored in the kidney, and the acquired essence, which is from the food, and then the qi from the nutrition qi or the grand qi, going to benefit. These qi are called acquired qi, and the acquired qi can be concentrated into essence, and this essence also stored in different organs. And acquired qi, or some of the acquired qi, also stored in the kidney. And the kidney, the innate qi essence, is nourished by the acquired essence, and these two kinds of essence stored in the kidney considered as the kidney essence. So all organs store essence, and then the innate essence stored in the kidney. So in our theories, we believe that the kidney essence is the most essential essence of the five Zang organs, which is also the most essential of our life activities. If the kidney essence, or if the kidney qi is not strong enough to control the essence, it will cause the irregular or pathological movements of the essence. And these can be the symptoms of the ladies' problem or men's problem, such as premature ejaculation or other men's problems. So in this condition, we think about the essence in the kidney, and from the essence, we need to remember, we need to understand where the essence comes from and what kinds of essence is stored in the kidney, which are the innate essence and the acquired essence. Second, the kidney dominating the development and reproduction. the kidney dominates the human growth and development. Because the kidney stores the innate essence. The innate essence is actually where the innate or the most origin area where the energy comes from, where the qi comes from. So the innate essence transforms into innate qi. That's to promote our human growth and development. And these kinds of essence and qi will be nourished and all will be supported by the acquired essence and qi. So these are the relationship between the acquired and innate. And you see that's only the kidney. When we talk about the kidney, we mentioned the innate essence and qi. That's because the innate essence and qi are stored in the kidney. So our human growth and development is based on the innate essence. And this also reflects in the human reproduction. The human reproduction also related to the kidney, which is as in the forms of the axons, or in ladies menstruation, in male sperms. So this, such as the sperms and menstruation, are the mature sign of human. So these physiological situation, this normal physiological situation will depend on the kidney function. If the kidney is weak, or the kidney qi or kidney essence is weak, and then the female, the ladies may have a late menstruation, or the first menstruation comes only at the age of 15 or 16. This is considered as late menstruation. Also, in their later in their life, they may experience like infertilities, these problems. For male, we also can have the problems if the kidney qi or kidney essence deficiency, such as premature ejaculation, and also other men's problems also can be infertilities. So these are all related to the reproduction of human being. And all these symptoms and signs are also related to genitalian organs, external genitalian organs. And these development and reproduction also related to the liver, because the liver regulates the qi. So these movements also depend on the qi. This growth also depends on the qi. That's why most of the condition, these problems, we always focus on the liver and kidney. And also we have a saying that the liver and kidney originate from the same root. Why in the treatments we always focus on these two. The kidney yin and kidney yang are the roots of the whole body's yin and yang. This is actually the same. The other way of saying the kidney essence is the roots of the whole body's essence. That's because of the kidney yin and kidney yang. Where they come from? It's kidney yin qi or yang qi is the same thing. The kidney yin and kidney yin qi, kidney yang and kidney yang qi are the same thing, and then the qi is generated from the kidney essence. Because of the innate kidney essence stored in the kidney. The innate essence stored in the kidney. That's why we say the kidney is the root of the essence of the body, the whole body's essence. So this definition, this statement just from another way to describe the essence qi and qi, or yin and yang. And the innate and acquired essence in the kidney can benefit each other. Initially from the innate essence, and then the innate essence can be benefit from the acquired essence. The second is the kidney governs the water metabolism. The kidney involves in the water metabolism directly in the forms of urine, the formation and the movement of urine. So where does the urine come from, or where does the water come from? The water metabolism we have mentioned quite a few times. Which organs are related to the water metabolism and how they're going to function? The lung, the spleen, and also the liver in the form of qi. And where does the qi come from? It's from the kidney, especially the kidney yang qi. The kidney yang qi is yang, which is warm. So this kidney yang qi can help the movements of the qi in other organs and result in the water metabolism in the whole body. And also the kidney involves directly in the metabolism of the urine. The water in the body, or body fluid in the body, when they transported to other organs and the waste of these fluids through sanjiao goes to the kidney and store in the bladder. This is how the urine formated. This whole process also depends on the kidney yang, kidney qi. The last function of the kidney is the kidney receive qi. The kidney receive qi, we're going to have a topic of the breathing, how the breathing function, the movement of breathing functions. The kidney receive qi in Chinese medicine theories. We think that the kidney can receive qi and pull the qi move downwards from the lung. That's how we can have a normal breathing. Otherwise, if the kidney loses the function of receiving qi, patient will suffer from shallow breathing, such as difficult breathing or asthma. This kind of symptoms, if you see, especially for asthma patients, if you see this kind of patient, the symptoms of them, the most typical symptom is shallow breathing. In this kind of treatments, we will use the treatments to regulate or to recover the function of kidney. That's because the theory is found here. The kidney receive qi. When we see patient with shallow breathing, we can think about the kidney. We may think that the kidney function is not well. That's why in the treatments we will use the acupuncture points or herbal medicine to help the kidney. And also for this kinds of patient, you also can find some other signs or symptoms from them, or even other history on their life history, such as this kind of patient, they may have late menstruation, or this kind of patient may have some family histories which are such as their parents are older or too young when they were born. So these are some histories of this kinds of patients due to the kidney function. So these are the functions of the kidney. The relationship between the kidney and others. The first, the fear. The fear as the emotion of the kidney. This example we have talked quite a few times, so we are not going to repeat it here. If you haven't watched the previous video, you can go to the Zang organs of the liver. So we should have the example there. The fear. And then the second, the body fluids, the spittle. The spittle, sometimes you will confuse this. The spittle is actually the same tones of saliva. It's an old tones of saliva. The reason why we use the spittle here, it's actually in the theories, the saliva in Mandarin, we separate them into two parts. The saliva, the clear part of the saliva, we call saliva. The thicker part of the saliva, we give it another name. But this term, we don't have translation in English. That's why we use a different term of the saliva, just to tell you that these two are all saliva, but different parts of the saliva. So the saliva, we're going to see this saliva, we're going to separate them into thicker parts and the clear parts. This kind of theories actually is also the yin and yang theories. You see, we always said there is yin and yang, yin yang. The saliva is the body fluid in the liquid form. It's also a liquid form, and it is yin because it's a liquid, or such as the same as the water. But this yin, there's still yin and yang in this kind of water. So there's still yin and yang in the saliva, and this saliva, we think the thicker part, we gave one name, the clear part, we gave another name. Then in organs, they actually relate to different organs. The clear part of the saliva related to the spleen. The thicker part of the saliva relate to the kidney. Then do you still remember the example that we gave you in the spleen when we talk about the saliva? If there's a patient that suffers from excess saliva, so the patient produced too much saliva in the mouth, and the saliva wets the pillows in the evening. This kinds of patients, how are we going to treat the patients? What kinds of treatments? So you can see from the saliva. So the first is the saliva. When you saw the disorder of the saliva, you need to think about the spleen, right? And then the saliva also include the thicker part of the saliva. Then here we use the term of spittle. Although they are the same, but just given a definition of spittle refers to a thicker saliva. So the saliva also includes the thicker part. So this is related to the kidney. So in our treatment, we need to focus on the kidney and the spleen, especially for the kidney yang and spleen yang. And actually, when you study more, you will understand that the spleen yang can be benefit from the kidney yang. These two are actually very close because the spleen is the earth, and that's from the acquired spleen yang is very important for the acquired essence, acquired qi, and this spleen yang need to be benefits from the kidney yang, from the innate kidney yang. That's why for this patient, we will focus on two parts, the kidney and the spleen. The next is the body constituents, the bones. Actually, the bones here also includes the marrow and brain. So in our theories, the bones, marrow, and brain are related to the kidney. which means if someone suffers from the bones problem, such as a fracture, or some kids, they did not grow as fast as he's supposed to. So in this condition, we will think that this is because of the kidney deficiency. And also, when we grow older and older, the senior people, they are more likely to have fracture, or they actually now we know that's because of the loss of the calcium in the bones. And for this condition, we also going to use the method to tonify the kidney to improve the kidney function to assist this kind of situation. And apart from the bones, our teeth also considered as part of the bones. So we also can see from the teeth, if someone they have their teeth loose or lost in very early age, then we will think that's the kidney deficiency as well. Or also some kids, the teeth grows in very late age. That's also the kidney deficiency. So in these conditions, we will treat the kidneys and the hair as the splendor of the kidney. So you can see the hair to predict or to consider the kidney function of individuals. And the growth of hair also based on the blood. Then you can see these are also related to the other organs as well. The blood, the heart, the spleen, the liver. That's how we treat the hair losing from Chinese medicine and acupuncture. We're going to focus on the kidney, we're going to focus on the liver, spleen, and the heart. The ear, the anterior and posterior orifice as the openings of the kidney. So if someone suffers from the ear problem can be any kind of ear problem, earache or tinnitus, so the noise in the ear, or even the ability of hearing. If they lose the ability of hearing, then we will use the treatments towards the kidney to help, especially for senior patients when their hearing gradually declines. Then we will use the treatments towards the kidney to slow down the process, slow down the degeneration. The anterior and posterior orifice actually refers to genitalia, external genitalia, and the anus. So anything related to these organs are also related to the kidney, such as the men's problem or ladies' problem, such as anything related to the menstruation or urine, such as difficult urination, or frequent urination. These are all due to the kidney. So for this kind of problem, we will focus on the kidney. The treatment we will focus on the kidney. In the 5 elements, the kidney is related to the water, and the winter also related to water. So the kidney corresponds to the water, to the winter. And actually from here, when the kidney corresponds to winter, you can see the phenomena from winter. What can we see in our nature? And then we can figure out how we can be healthier, or what we should do to help the kidney. As you can see in winter, everything in the nature stop growing. The leaves falls in autumn, and then all qi concentrate back to the root for the next year to grow. So everything stop and concentrates. That's exactly what happens to the kidney. The kidney need to store the essence. That's the main function of the kidney. You see, this function is very different from the liver. The liver governs the flow of qi. The liver needs to promote the qi movements, but the kidney need to store the qi, need to store the essence. The kidney need to limit the qi movements. So this is the balance between the kidney and liver in terms of the qi movements. The liver need to promote, the kidney need to limit. If the kidney loses the function of limit the qi movements, then the flow may be too fast, or there may be excess flow of the qi and blood. Then the patient may suffer from, such as excess blood in the menstruation, or for men's premature ejaculation, or other men's problem. These are the kidney loses the function of control or store. So this is the opposite parts, yin and yang parts of our physiological situation in our human body. So these are the different functions and different organs, the characteristic of different Zang organs. Zang organs are the most important organs, and their function are also most important in our physiological condition. So we need to understand what's the function, and then now we introduce all five of the Zang organs. Then we also need to understand the relationship among these organs, these functions. Although when we introduce one by one, but as you can see, the more we introduce, the more they integrate together, such as hair. The growth of hair related to the liver, to the kidney now, but the nutrition for the hair also from the blood. So if we will need a function from the liver, the function from the spleen, also the function from the heart. Or the other example, for the breathing. For breathing, in order to have a normal breathing, when we discuss the lung governs the qi, which include the innate qi and acquired qi. The acquired qi also include the qi from breathing. So the breathing function or the breathing movements is very closely related to the lung, but the lung is not enough. If only the lung, we will have very shallow breathing. That's because of the function to receive qi, to pull the qi downwards, to have a deep breath. That's the function from the kidney. The kidney receive the qi. So the breathing function, the breathing movements from inhale and exhale, it looks very simple, but this function actually includes multiple organs. The lung, the spleen also, because it transports the qi, and the kidney receive the qi. So these are the relationship in our physiological condition. Also, the other questions, how does the blood ferment? The blood goes to the middle jiao, the spleen and stomach. The middle jiao absorbs the food and water we eat in. It transforms into the qi. The qi transforms when the qi moves to the heart turn the qi into red color. The red color we call the blood. So in this process of the formation of the blood, the spleen receive the food and transforms the food into qi, right? The movement of qi also governed by the lung, because the lung governs the qi, and the heart. So as you can see this, until now you need to use all these theories to explain how physiological conditions. The more you think about it, the more interesting it will be, and the more you will understand our theories, how to use these theories into practice. When you see a patient with breathing problem, then you need to think about the lung, the spleen, the kidney, because you already knew that the breathing function is related to these three organs. When you see a patient with blood deficiency, you will think about the spleen, you will think about the lung, the heart. It also might be other organs according to the different symptoms. When you saw a patient with disorder of urine or urination, then you will think about the kidney, and sometimes you also think about the liver, because the urine or the anterior orifice or the external genitalia is related to the kidney. And then the function of these organs also related to the function of qi movement, which is in charge by the liver. So you can think about the liver and the kidney. So these just brief examples of these theories, how to apply into our daily life, our daily practice, and that's also how to maintain our health. If you learn Chinese medicine and acupuncture theories, how to benefit our health in our daily life. Okay, in next video, we're going to introduce the full organs. That's the other categories of the internal organs. Thank you, guys.